count us down. And welcome everyone to Hemp Your Health. Today is a special show. We're going to go into specific chronic pain conditions. And first, before our incredible guests get introduced, I just want to take a moment to pause and breathe and be grateful for the amount of consciousness that is expanding in the areas of education and resources. So with just a tiny little bit of due diligence and digging, you have more information at your fingertips that can contribute to your health, healing, and prevention than ever before. And today's intention is to contribute to that so that we can all understand and help our friends, neighbors, family, and communities about the conditions and severity and consequences of chronic pain. So November is Complex Regional Pain Syndrome, or CRPS Awareness Month. And our two guests have personal and professional experience with this. Our first guest is Jim Broach. He is a master's level social worker and has served as the executive vice president and director of Reflex Sympathetic Dystrophy Syndrome Association, or RSDSA, for 20 years. RSDSA is a premier go-to organization for people with complex regional pain syndrome, or CRPS. Its mission is to provide support, education, and hope to everyone affected by CRPS while driving research for better treatment and a cure. Previously to RSDSA, Jim served as the executive director of the Obsessive Compulsive Foundation, OCF, for 9 years. And we do have a special shout out in his honor. Today is the 245th anniversary of the Marine Corps, which he served on. And was stationed in Vietnam. After Vietnam, he went on to work with children who were suffering in the public school industries, in the public school systems, and worked with them in alternative schools. And then he went back to school at the University of Connecticut of Social Work and went on to be the executive director of the YMCA in Orange, Connecticut, which led him to the Obsessive Compulsive Foundation and then the RSDSA, and presently with us today. Thank you, Jim.
Thank you, Christy.
And also Heather Cottle, which I hope a lot of you recognize her because she is part of the Seed to System family. She's our national sales director. She also has a relationship with Shane Mutter, our president and CEO from the bedding and mattress industry. And she has a wealth of information and experience from pharmaceutical sales, marketing, and operations. Thank you both so much for being here.
Thanks, Christy.
Oh, you're welcome. So in the spirit of CRPS Awareness Month, let's kick this off with our first question, which is, what is CRPS, or Regional Sympathetic Dystrophy Syndrome, and CRPS is Complex Regional Pain Syndrome, and how are its symptoms different, or how do they compare with other chronic pain syndromes like fibromyalgia and neuropathy?
Heather, let me start and then please jump in, okay? CRPS is probably the only medical syndrome. Syndrome is a collection of signs and symptoms that starts with the word complex. Over the years, CRPS has been called so many different names, and as the science has evolved, they've changed the name. Our reflex sympathetic dystrophy used to posit that everything was related to the sympathetic nervous system, and we realized it always wasn't so. So they met a consensus conference and they changed the name. So basically, it's a diagnosis of exclusion. It is rated by the McGill Pain Index as having the highest degree of pain, greater than cancer or even the amputation of a digit. It is basically the overwhelming symptom is pain out of proportion to the inciting incident. And then there's a constellation of symptoms. Generally in the acute phase, there's color changes, that there's sweating, there's swelling, and there's a cardinal symptom that doesn't happen to everyone, but it's called allodynia, which is a hypersensitivity to touch sensitivity. And then basically what happens too often is that people have such pain, they realize if I don't move, I will feel less pain. And basically, the whole goal that we're trying more and more is to try to get people to somehow, with some type of intervention, to modify the pain, and then to really focus on improving function. So it's kind of a jigsaw that you put together, you exclude other conditions, but the overwhelming symptom is chronic pain that is just unbearable 24/7.
Yep. I joked with a friend of mine when I was first, because it's usually, they don't know what triggers it. Either you can step on a Lego, it can be some kind of traumatic, sprain your ankle, break a bone. Mine was, I had a surgery to remove a Morton's neuroma. It was supposed to be a simple surgery, and that was going to make the pain go all better. And little did I know it was the beginning of my nightmare. And it made it 10 times worse. And I joked that I needed a horse tranquilizer, and little did I know that that was one of the, main treatments was a horse tranquilizer named ketamine. And of course my cat's coming into my lap. But my foot looked like it was dead at times. It was totally black. My coworkers, you have corpse foot. It looked black, like a corpse. It was cold. The temperature difference between my left foot and my right foot could be as much as 10 degrees, and it would be completely a different color from it. And the fan, the wind blowing from the fan would hurt my foot. Just like a breeze blowing would feel like razor blades going across it. It's, the sensitivity is off the charts. When I was diagnosed, the doctor took his hand and just ran it up the bottom of my foot like that. And I felt like I got hit with live jumper cables. My butt came off the seat about that far, and I screamed like a little girl.
I wonder how many people are hearing about complex regional pain syndrome for the first time, because this working with Heather was the first time I had heard of it. But we do hear a lot about these other systemic pain conditions, but this is significantly different with the highest degree of pain that sounds relentless. What population is most susceptible to CRPS? Is there a population?
There's been a few epidemiological studies, and basically it's overwhelmingly female. We're talking about 4 out of 5. And believe it or not, it's older women. 50 to 70 is the largest cohort, but we're actually seeing it in children. There's actually a case study of a child as young as 2.5 years old.
Oh my God.
The thing we don't understand at this point is why generally most children will get better, and that might not be totally resolve the pain, but their function will improve. And a lot of that is that there's a lot of pediatric rehab programs that focus on movement, and also give them the tools because so painful when you move, but if you don't move, you are screwed, to put it bluntly.
Wow.
Yeah, you'll lose all. I was guilty. In the first 6 months, first of all, I was devastated. I because the last 2 years that I was in pharmaceuticals, I spent working in pain management. So I knew what complex regional pain syndrome was. And I was more devastated for the fact that I knew I was looking at a lifetime of opiates, and that terrified me more than a lifetime of pain, because that's not a road that I wanted to go down, which I am so freaking thankful that I did meet Shane and I did find Seed to System, because that has been a lifesaver for me. And it's been able to keep me, and I don't have to take the oxycodone and things like that. I take a small milligram dosage of methadone, and 5 milligrams, and that keeps me at bay. And like I said, I did the spinal stimulator, and those two things have given me my life back. In fact, when I met Christy this summer, she's like, if you hadn't have told me, I would not have known that anything is wrong. And that's how far I've come. And talking to my PA and everything, she's like, I'm now one of the least severe cases of CRPS that they have in their clinic. And I'm like, I can actually go out and walk and exercise and walk for 2 miles now, as long as my back will hold up. It's not my foot now.
Do you think that's because you got an early diagnosis? Did that contribute to some of these really promising successes you're having? Because I read too, your website, Jim, is amazing. So we'll be posting the website and some links to those websites for your resources and references too. But now I lost my train of thought. Oh, I read that there's CRPS stage 1 and CRPS stage 2. And let's just say, next we're going to go into how is this diagnosed, but let's just say it hasn't been diagnosed, you've been living with this, then stage 2 is when there's permanent nerve damage. Is that correct? Did I read that correctly?
I would think it more of I like to think of the stages of kind of being discounted now, and I think of acute onset and now chronic. You know, the studies in the UK talk about that up to 75% of people will really do well. And what we have blinders on, because generally at RSDSA, we deal with the people on one side who are newly diagnosed, and they'll call us up and they'll say CRPS, and I'll say, oh, it's probably a person with newly onset. And then there's other people who will call us for months and years and say, what's new? You know, they have it chronic and they're just in a world of hurt.
So early diagnosis sounds like it's really pivotal to making sure this doesn't go chronic. How is CRPS diagnosed?
Well, again, I think it's important it's a diagnosis of exclusion. And there's Budapest criteria, and basically they're looking for different signs, whether it be vascular or we're talking about movement disorder. A lot of times people with CRPS will have tremors and spasms. And important is what Heather talked about, the temperature differential. When I talk to people who are having trouble, I'll say, does anyone ever give you an infrared temperature? And the doctors and physicians are not checking the temperature between the affected limb and the unaffected limb.
Wow.
Yeah.
Okay.
Heather, I would just want to go back to you. Were you able to shower with your affected limb? How did you deal with that when you were just so symptomatic?
I could handle the warm. That actually made it feel better. So I would just ease into it very slowly, but that warm would help it. So I actually looked forward to showers. I could let the water hit at the top of my leg and run down. So as long as the water wasn't pounding directly on my foot, I was good. And I'm one of those girls, you know, I don't scrub my feet, so I don't let you touch them. I never liked pedicures. I was one of those freaky girls. So, you know, I'm good. I got soap on it. I'm good.
Back there, because one of the cardinal symptoms is that allodynia, the hypersensitivity to touch. And so often when you talk to people, and when we used to do pre-COVID, when we did our in-person conferences, in the middle, people would come with shorts because they would have lower extremities CRPS, and they could not tolerate fabric. And they would build blanket beds over their bed so the blanket would not touch them. And it's just unbelievable. And that can be dealt with, but you have to really go to a sympathetic, empathetic physical therapist who could work with you very slowly to normalize the sensitivity so that the pain signal, when it's recognized by the brain, it's not. Because CRPS, then the original injury will heal, but the pain still continues.
Say that again. The original injury will heal, but the pain continues.
Yes.
So the injury, let's say it was a soft tissue injury, that can recover, but the pain is still is still in that regional area.
Well, no, it's actually moves from the peripheral nervous system to the central nervous system. And they've actually documented in the brain changes in the gray matter. And basically, which they can be changed with good treatment, but more and more early treatment, especially when it's in the limb, they'll look at to change the neuroplasticity of the mind. And I don't know if you've heard of mirror box therapy, but it's two types of therapy. It's called graded motor imaging, where there's been brain mapping changes. So where individuals with CRPS sometimes cannot, when they look at a picture of their hand, they cannot recognize it as their own. And so you have to do some exercises to change that. And then you work on the motor mirror box, where that you will take your affected hand and put it behind a mirror. And over time, after you first imagine movement, because so often when people imagine movement, they feel pain. And then eventually you're going to trick your mind that your affected hand is just like your unaffected hand.
Wow.
It's magical.
I was very fortunate to be diagnosed, within 2 weeks of surgery. So I was immediately put in physical therapy and doing desensitization. I can get that out right. They paired me with physical therapists that were familiar with CRPS. So I was working on toe yoga and picking up marbles. And if I ever see another marble, I walk in physical therapy now and I'm like, oh God, there's marbles. No. But those people, they helped me gain my life back. So I'm greatly appreciative because, now when I'm walking down the street, I'm walking on 2 feet with almost a normal gait, and people don't know that I have CRPS in my extremities.
More and more, we're hearing of CRPS as an invisible illness. And you would never know that she has a chronic illness that is just so just so painful. And that's great. She's working, which is fabulous.
This is probably when a lot of people say it's all in your head, which is absolutely shame on them, because patients, and especially with this syndrome, really need a voice. That's why your foundation and association is so important, because what did people do before they had these resources to learn about? They were probably, total drug addicts, or with the highest degree of pain, trying to look for a way to validate their reality. So now we know a little bit about how it's diagnosed and resources we can go to. What are some of the current therapies and treatments that people are getting for CRPS?
So again, Heather mentioned some of the invasive procedures like a spinal cord stimulator, but you also talked about methadone, and methadone really makes a lot of sense as a medication because it blocks a receptor that's NMDA receptor, and that also is blocked by ketamine. A lot of times people are going to utilize ketamine a number of different ways. The best way right now is infusion therapy, but sometimes it's not covered by insurance and it can be in bank busted. And but the whole key, Christy, is I believe is that basically modify the pain and really try to get to function. The whole key. And sometimes even people who have been in bed for years, bedbound, but they could work with a physical therapist with baby steps to really regain function. And there's still a lot of hope out there, but a lot of times people have given up hope because they haven't found that doctor that really is familiar with CRPS and has put together a team. It usually cannot be done by one physician, one intervention. When we do our conferences, we talk about treating the whole person, achieving wellness. And too often the care given in our sick system in the United States is fragmented, and people will get medicine, not therapy. Heather, did you ever see someone for psychological therapy?
I did. I told you, he's the one that called it CRPS. He didn't call it CRPS. He called it CRPS. And he really helped me a lot. It worked through, meditation and being able to calm myself down, because when you hit a flare, sometimes you are you just want to curl up and cry. And sometimes you have to just center yourself, breathe in, breathe out, and calm down, because stress exacerbates the condition as well. You can get upset, stress yourself out, and throw yourself into a flare. And it's a vicious cycle.
I was listening to a fabulous podcast earlier, and I could send it to Christy later, but it was called The Death of Caesar, and it was psychological interventions for grieving. And so often we really don't talk about that, but if you do not get better, you lose your role, you may lose your income, you may lose your marriage if you're married, your job, your identity, and too often you're just going down that rabbit hole.
And people lose their families, their friends, everything.
Yeah.
Because they don't believe you. I think it's, again, in your head.
Yeah.
Get up, walk it off.
Yeah. So often people would CRPS to say, I wish I had cancer, because then people would care. People with meals.
That's horrible. That is heartbreaking.
I actually said that. I said that because for the sheer fact that there's a treatment protocol that I know that you can follow. There's a treatment protocol that'll put it in remission that you can follow this step A, B, C, and put it in remission. This, you're throwing darts at the wall and seeing what sticks, because each person is so different.
Christy, what we're hearing too is a lot of people are doing CBD now. They're doing homeopathic. What Heather talked about, the mind body, we're all there, the breathing, the distraction. If you concentrate on your pain 24/7, you're going to be in pain 24/7. So you have to try.
That's such a good point too, because when you were talking about treating the whole person, I love that philosophy, because so much in Western medicine, we try to isolate a problem. And let's just say this is from trauma. We don't have to necessarily address the trauma, because there might have been multiple traumas, but we need to address all the systems. And this is why I love the conversation of the endocannabinoid system, because it helps the body get back into the resilience to stress. And it extincts those fear memories. Part of the ECS is to help the body forget. And when we're constantly in those feedback loops of trauma, how can anyone recover? Because the inflammation goes up, the support to the immune system goes down, and it's not a healing environment. So the ECS is definitely important. I hope we do more and more research around the ECS and hemp and chemovores and all sorts of different cannabinoid treatments, because it's also one of the more affordable approaches, and to help have people have as many choices to experiment with their treatments, especially as they go from more of the chronic to the acute. It would be helpful. And so, Jim, I want to go back to the physical therapist conversation, because your association does Facebook Lives once a week. And you've had some physical therapists on that are wonderful. And I really want to do a shout out to all the physical therapists out there to go back through their Facebook Lives and look for their physical therapists, because this is something that I feel like, from the few physical therapists I know, they don't know that it might be hard for them to even perceptualize the amount of pain and the type of treatments, because everyone wants to get to results faster, but sometimes just no pain or less pain is the result that could be considered successful in these treatments. And that takes a lot of understanding professionally and personally for individuals.
I think you're so right. In just as most physicians are not familiar with CRPS, most physical therapists are not either, unless they're in a class where someone had it and did the in-service presentation. And some really great therapists out there that I've been pleased to know and have guided our organization. And it's wonderful. And more, we're trying to empower people to be their own advocates and to really sense whether this therapist is the right person rather than the no pain, no gain. It's like we regain functioning.
Well, this is good. I think doctors, physical therapists, even psychologists can really benefit from understanding what's going on in the brain and the changes in the brain. This is profound. This is not just your pain is in your finger and that's it. What you were talking about, the mirrors, and really having to retrain and reorient the brain to the body doesn't sound like an easy task, and it takes a lot of commitment also on the patient to be patient and be willing to experiment, and that there probably isn't a quick fix, but that consistency and movement and keeping the flow in the body and the stress levels down and having support for around them of the friends and the family and the communities. That's another reason why RSDSA is so profound.
Lucy, may I just interrupt you for a second? You know,
Yeah.
what we have to talk to is the profound lack of sleep. If you're in pain, sleep. And then the other thing too is like 80% of people with chronic pain, and we're talking about 50 million Americans, you know, they're depressed and anxious. And that, again, it's the stress, it really affects you.
Well, you know what I'm going to say. There's a lot of evidence around supporting, and some of the reasons the ECS is so important, we're seeing so many benefits from its function, is because it's been dysfunctional. It's literally been clinically deficient. And sometimes you just have to feed it to get it jump started. So it just starts to signal. And that signaling has to happen between the central nervous system and the gut and the muscles and the lymph system for the immune system. And all this starts with just signaling so that the body doesn't feel like it has to be, you know, this complex regional thing, which it has to be this whole body approach. And the ECS definitely can help with that. But I would love to see some studies of some real therapies of people go back to back with people that are using a full spectrum hemp or cannabis, and someone with a very similar condition going through the same therapy without the support of the ECS, and start to get a lot more anecdotal and clinical research around this to validate it too, because still people on the medical field think that the ECS is sort of, fuddy-duddy, but if we could really move the needle with these syndromes, this is a lot of complex words, complex syndromes, but complex words. I think we'd be really supporting a lot of people's recovery and day-to-day quality of life.
The sad part about research money is that only 2%, less than 2% of all healthcare dollars are invested in pain research, but it's the number one or number two reason you go to the doctor.
Wow.
So it's terrible.
We definitely, excuse me, need to shift our consciousness around what did you call it? Medicine, as far as, a one bullet therapy, stuff that we're really good at just killing things, killing the pain, killing the bacteria, killing this, killing that. But what about, really resolving things and bringing people into a better quality of life and health as a result? I think everyone knows I'm really passionate about people feeling that they have a lot more empowerment. And when they advocate for themselves, especially with associations like RSDSA, that you're going to have friends and family and support on your side. You don't have to do this alone. And Heather, can I speak for you that it's all right for people to also reach out to you?
Absolutely. Absolutely.
And do you have any, before we go into how to get a hold of both of you, do you have any wisdoms to share with the audience?
I mean, the biggest thing is keep moving. And I know sometimes it is hard to stay positive because it is, I mean, it's a blow. It's a blow emotionally. I'll admit, you know, I retreated for a few months and just cried my eyes out. And then I said, okay, I can't do this. I have a beautiful 13-year-old son who needs his mama, and a jerk of a cat that obviously needs his mother too. But you know, I got up, and you know, they told me there's nothing physiologically wrong with your foot. You can get up, you can walk. It's gonna hurt like hell, but move, get up, move. And you know, I got the coconut oil and the lavender salve, and I, you know, started using the CBD. And you know, advocate with your doctor. You know, I love my doctors. And you know, Jim's very familiar with, he's actually got, you know, Dr. Rout coming on. He is partners with Dr. North, who is my doctor, on his Facebook Live this week. Hush. Very mouthy cat this morning. But advocate for yourself, ask questions. You know, I had an issue with one of the medications. I didn't like it. I asked my doctor, I said, this medication's causing problems. I don't like it. What do you think about this one? Join support groups. I think I'm in like 6 or 7 on Facebook. And that's where I learn a lot about different treatments and medications and things that are out there. But ask questions in those support groups. You will learn a lot. And you can get me. My email address is Heather@Seed to System. As long as you can remember Seed to System and that my name is Heather, you can find me.
Oh, this is so good. And Jim, before we go into where people can find you, I just want to do a shout out about nutrition too, because it is a full body therapy, and the nervous system needs nutrients. You can deplete it, but I mean, it's constantly being depleted these days through stress and toxins and traumas. And so even with just a little bit of good food, we're going to see my new foundation principle is heal faster than you injure. And a really quick way to continue the injuring is with sugar and processed foods and foods that have been genetically modified or have glyphosate in them, because they are literally carcinogenic and inflammatory. And just by removing some of these foods, the body's going to be able to adapt, and you're going to get more out of your therapies. And the, you know, whatever therapies you're doing, you're going to get better results if you have better nutrition and you build up those reserves so that your nervous system and your immune system and your muscular system can repair, because this is really about repairing and not just some magic bullet. So
I think that's so important, because I think there's not one grand slam. You know, one Dr. Pradeep Chopra, who often speaks at our conferences, he talked about it's 5% here, 5% here. It all adds up.
Yes. And it'd be really nice if there's a magic bullet for any single one condition, especially this. But I'm a big fan of experimenting. And then Jim, I'm a big fan of yours and RSDSA. Can you explain how people can find you and your website? And we'll be putting all of this into the notes too.
That's great. Well, again, it's CRPS Awareness Month. We're on this coming Thursday. We're having Dr. Richard Rock, who is a world-renowned researcher and clinician. He's going to be talking about some of the interventions to help forestall the progression of CRPS. So I'm really excited about him. He's really a nice man too. And our website is rsds.org. That basically we're compassionate, we're empathetic, We're there to help you get on the road to recovery. The beautiful things on our website, we have on our YouTube channel, RSDSA, we have over 165 videos. We have videos on nutrition, PT, psychological therapy, interventions. You know, what about if you're injured and we have a lawyer talking about how do you know you have a case, you know, and that type of thing. But we're here, we have a toll-free number, 877-662-7737. Sometimes we're not in the office because of COVID. We're kind of in and out, but we get back to people.
Oh, this is so good. So YouTube channel, website, your Facebook Lives, a wealth of information and resources. So everyone can share this resource with your friends and family, especially if you think that someone is being misdiagnosed or undiagnosed and they need the right therapies and the right diagnosis so that they can be on their path to recovery. Another shout out to your service as a Marine and the Marine anniversary today. Thank you for all the people who have served and taken care in the protection of our country. We need so much more of that. And thank you both for coming on. I love this topic, and I love that both of you have such a deep wealth of empathy and understanding for the people with these conditions, because, you know, with the way the world is, we might see more and more. And if we can catch it easier or earlier, then we're just going to be contributing to better people and better health. So I hate to wrap this up, but you know what I'm going to say. Join us, join our team, like us on Facebook and Instagram. We're going to have a YouTube channel where we're going to be posting all these videos. We're so grateful for this education in both of you, and just everyone go out, be conscious of the resources out there and the education that's at your fingertips. Dig in, treat yourself well, and enjoy your health and hemp. Bye for now.
Yes.
Enjoy your health and hemp. Bye, everybody. See you next week.